Hello and welcome to today's session on dental hygiene. For those of you that don't know me, my name is Crystal and I am a health and well-being consultant here with Borislow Insurance. We also have another side of our house that we have many clients under called Captivated Health. So welcome if you're from either side of the house. We are excited to have you join us today. With that being said, I am not a doctor, I'm not a dentist, I'm not a hygienist. And so as a full disclaimer, today's session is for increasing awareness, it's for educational purposes, it's to drive engagement. And if you have any questions or specific concerns or anything like that, definitely start with your human resources. They know your benefit plans best, but if not, reach out to your personal dentist, or if you don't have one and need help finding one, we are always here to help with that as well. So just as full disclosure, today is for increasing awareness. So today we are going to go through various educational pieces, and I will also encourage you to feel free to join in on the chat. We're welcome to enter, where you're joining us from today. I am joining from New Hampshire. Say hello to those in the space with us. And so I will also be hosting engaging polls. So they're really simple questions. You're welcome to participate. I encourage you to participate. And so you can't do them wrong. There's no right or wrong answer. It's just to increase your own personal awareness. So without further ado, I'd just like to start with kind of giving you a little background of who we are and what we do. So if you haven't heard of Borislow Insurance before, you haven't, maybe you're an employee of one of our clients, essentially what we do is we are a full circle of various services that support you and all of your employees. And so what that may look like would be health and well-being being one of them, but it could be also human resources or risk management, retirement services, compliance. And so we have a ton of different options. If you have any Medicare questions, we have a full team. So I have lots of individuals who join me in our space to support you in whatever you may need from a day-to-day perspective. With that being said, specifically here in health and well-being, we like to focus on a holistic approach. So the entire employee, we are all humans. So that's our physical well-being, our financial, mental, and social well-being. Q4 is a great social well-being element as holidays approach and end of year approaches, and we kind of tend to connect a little bit more as well. So we also help design custom programs. We love actionable, measurable results. I love the data. And we also help with communication plans as well and strategy. So if you have any health and well-being needs or interests, please don't hesitate to reach out. You can send us an email at wellness@borislow.com. So without further ado, today we're just going to cover what is dental hygiene, why it's important, and how to create a dental hygiene routine for yourself. So really simple, but really important. And sometimes we kind of just go on autopilot. I'm not sure about you, but I'm human as well. And sometimes we enter autopilot on our day-to-day routines. And so we would like to take October as increasing awareness to our dental hygiene. It's one of the less observed health observances, I would say. So what is it? So dental health refers to the health of your teeth, but also your gums, your tongue, and the entire oral facial system. So that includes things like your lips, your palate, all the muscles, your throat, the jaw, saliva glands, your cheeks, the joints, and all of the various nerves that are all intertwined in this region and space as well. So good dental health and oral hygiene helps us to speak clearly. It helps us chew, taste, and swallow nutritious foods. It helps us to make facial expressions and smile. And that, of course, improves our self-esteem and our confidence as well. So you can see, I'm going to talk about a few things, but a general tooth anatomy on the screen to your right. So it talks about the top part of the tooth as the crown and the bottom as the root. And we'll talk about a few different things, but enamel is always the part that you see. And that's that white layer that you can see around the tooth. I would say gums are also a really popular space that we'll talk about more as well as the bone and the nerves as well. So there are a few other spaces, but just a generalized tooth anatomy as we dive in, because sometimes we may not know or we haven't thought about it in a long time. So I'm going to launch a poll. I encourage you to participate. Again, this is just a reflection practice. This is not to be judged or anything. This is just the human element of how would you rate your current dental health? Would you say it's excellent? Maybe it's fair, or maybe you feel like right now it's poor, and that could change on a day-to-day basis. It could change for a number of reasons, and absolutely. So if I were to judge my own dental health, I feel like, keep in mind some things are out of our control. But I would say mine's pretty fair. I feel like I can always improve. And so that's where I would rate myself. But I'm going to go ahead and give just a moment or two. If you would like to participate, I love the engagement. So thank you so much. Again, this is not to be judged whatsoever. We are all human. This is just to increase and pause. We may not reflect on our dental health and hygiene on a regular basis. So this is for you and your awareness. I'm going to go ahead and end the poll and share the results. And so you can see some have excellent health and some have fair health. So thank you so much again for participating and joining me in that poll. So I really want to hang out here for a moment and talk about why we're talking about dental health and hygiene and why it's important. So it kind of separated that into dental health topics and health condition topics as well. So feel free to take what serves you and leave what doesn't, and hopefully you learned something today. So with that said, dental health, a few things to look at are plaque buildup. So that's that really sticky, colorless, almost film of bacteria on the enamel, which is that white part of the tooth. If this becomes hardened, it actually changes to tartar. So that has to be removed from a dental hygienist, so through a cleaning. So if you have a lot of plaque buildup and then have a hard time getting it off, it could harden, and then that's when a cleaning is necessary. It can lead to tooth decay, which are basically cavities caused by the bacteria and the acids from plaque. That could then lead to the loss of teeth, which also limits our food intake and causes nutritional problems. It could lead to mouth sores, or gingivitis is very common. And gingivitis is any red, swollen, or bleeding gums. And keep in mind, gingivitis is also increased if you're pregnant, then you're at a higher risk of gingivitis as well. Could be bad breath or some dryness. Some medications cause that. Could lead to gum disease, which is inflammation and infection. This causes a loss of that bone support underneath in your jaw, and it can make chewing really painful or cause some sensitivity. It could lead to abscess. So abscess is when you have a severe infection in your mouth, and that could actually lead right to your bloodstream and can be fatal. So I'm not trying to be dark. I'm trying to just increase awareness here. So please be mindful of your dental hygiene to avoid any negative effects. And then lastly, gum recession. So this exposes the tooth roots, and those can decay as well when exposed to bacteria and acids and any sort of decay as well. On the other side, I just want to note that going to the dentist is really important because they can notice a few of these things, maybe under the dental health space, and hopefully help work towards prevention of a serious health condition. So if we have poor dental hygiene, we are 2 times likely to experience heart disease. So that plaque buildup actually can be swallowed and can clog our arteries, which are the blood vessels that send blood directly to our brain. And then this can actually lead to stroke. So being mindful of that. It could possibly lead to dementia. So any tooth loss can actually lead to memory loss. And you may have seen an increase in dementia kind of across the board, I would say. It also can lead to respiratory issues or concerns. So bacteria can enter the bloodstream and then move directly to the lungs, can cause bronchitis or pneumonia. And then diabetes. So 95% of individuals with diabetes also typically have gum disease or loss of teeth. And that's because they're more likely to contract certain infections. And then, of course, oral or throat cancer, because bacteria growth at the base of the tongue towards the tonsils actually can, if it is allowed to grow, so if we have poor hygiene, then it can actually change your cell growth. So we just want to be mindful why it's so important that we may think, oh, we have some plaque, that's normal, we have to eat all of the things. But if we don't take care of it on a regular basis, it could lead to some serious health conditions. And as we know, heart disease is the #1 across the board in our nation. And so really just paying attention to maybe some of the dental health and helping towards prevention of the serious health conditions on the other side. And you can see in the diagram that there's you can see the recession of the gums. You can see kind of where there's space in between the teeth, where there might be some teeth missing or bleeding gums. And so this is just an example. As always, you know your body best, so to be mindful and to pay attention. I'm going to go ahead and launch our next poll. So when was the last time you went to the dentist? Was it maybe 0 to 3 months, 3 to 6, 6 to 12 months, or a really long time ago? I have to be completely honest. When I was younger, I was very nervous to go to the dentist and I did not want to go. So I didn't go for a very long time. I just paid for dental insurance. And that's just part of being human. So I just wanted to be really honest. So I hope you feel safe to share as well. Again, just being mindful, like, I'm not sure the last time I went. So now I'm on a much better routine and schedule. And so I think I went in August. So I'm going to say just a few months ago. So thank you for participating. I'm going to go ahead and end the poll and share the results. So great work, everyone, 0 to 3 months. So I'm very happy to see that dental health and hygiene is important to you. So great work. That's sometimes larger than you may even know. So let's talk about a little bit of lifestyle choices. So we love prevention, day-to-day actions. What can we do to help this? And so let's start with substances. So for example, we are hoping to decrease some substance use. So one being alcohol. So bacteria directly enters the bloodstream versus the digestive system when we take in alcohol. It also causes dehydration, which leads to plaque buildup and tooth decay. So I know alcohol is a very common substance, I would say, that's talked about across the board, depending on your area or whatnot. But just to be mindful that the alcohol directly flows right into your bloodstream versus the digestive system, which really is what carries the bacteria. So just to be mindful of your intake. Tobacco. So if someone uses tobacco, regardless of its form, then we know that they are 3 times as likely to lose teeth, as it decreases the jaw bone. It also inflames the saliva glands, which delays healing. So again, if you or someone you know uses tobacco, there are many resources to help them quit. But to keep in mind, any substances, specifically paying attention to alcohol and tobacco use, I know they're very common and sometimes not talked about. And so I just want to be mindful that if you're taking them in, this does affect your dental health and hygiene. Moving on to breakfast. So breakfast, as we know, is important, but it also is really important for your dental health because it helps regenerate the saliva, which helps protect your teeth and your digestive system against bacteria and acids. So again, after we sleep for a while, we then need to kickstart all of our systems, and breakfast helps us do that. Our water intake, so increasing our water intake across the board, hydration, of course. Water, our bodies are made up of mostly water, so we all know that it's really good for us. But to take it in, especially after you eat, maybe, because it helps remove any leftover food particles that you may have in your mouth as well. So I know some individuals, maybe you work from home, so your toothbrush is fairly readily available. Maybe you bring a toothbrush to work to brush after lunch or something. Maybe you don't, and you have water available, and that is also really helpful to use during the day. And then from there, nutrition. So decreasing any sugary foods and beverages. Keep in mind, we just talked about alcohol. There's a lot of sugar in alcohol. And we want to decrease that because sugar causes cavities, which is tooth decay. We also want to keep in mind that any starches we eat actually turn into sugar. So being mindful of that. And then increasing any fruits and veggies as they help stimulate the saliva flow to aid in the remineralizing of the tooth surfaces. So again, fruits and veggies are always good. They have a lot of minerals in them, and that in turn really helps our tooth surfaces. But also be mindful, and I didn't put this in there, but as I'm talking to you about it, I know my dentist said, be mindful of eating bananas because they are really sticky, and so they actually stick to your tooth and have a lot of sugar in them as well. So just to be mindful of what you're eating. And so sometimes it's helpful to eat foods that might be a little bit more firm, as they are less likely to either stick to your tooth or get stuck between the crevices as well. So again, just a few lifestyle choices. So minimizing substances, maybe having a little light breakfast to help stimulate all of our systems, increasing our water, especially after we eat something, and then being mindful of the foods that we take in, maybe hopefully a little bit more firm versus the soft and sticky that create that plaque buildup. All right, so let's go ahead and do our next poll. How many cleanings does your personal dental insurance cover per year? Is it 2, maybe 4, maybe we're not sure? Or if I didn't put the answer on there, I apologize. Closest guess works. So how many cleanings does your dental insurance cover per year? I'm going to go ahead and end the poll here and share the results. So this is great. Minimum is usually about 2. 4 cleanings are my personal preferred. Again, it's always different for everyone, but going at least twice a year or once a quarter is really nice for, again, helping you take care of anything that you might have missed naturally as you're cleaning your teeth. So let's move into our dental hygiene practices. So a few practices, or to be mindful and aware and kind of bring awareness back into our dental hygiene on our day-to-day, because I don't know about you, but sometimes I run on autopilot, or sometimes I'm trying to brush kiddos out the door and trying to get them to brush their teeth too. So again, just being mindful. So the first one is flossing. I think I read the statistics latest were about 40 to 43%, I want to say, of humans basically floss occasionally, and about 20% don't floss at all. So I personally don't love flossing, but it is something we have to do. So we just kind of do the best we can, and because we know it's good for us. And as you saw why it was important, flossing is the first thing that I would recommend doing at least once a day. Again, twice is great, but at least once a day is really, really helpful. And to floss actually before you brush your teeth. So I thought this was interesting too. And I hope that you find it interesting, but flossing actually will help kind of break up anything that is stuck between the teeth before you start brushing. So flossing first and then brushing. We all know brush twice a day, hopefully morning and evening for 2 minutes. So again, 2 times a day, 2 minutes, and replacing your toothbrush every 2 months or so. If you have an electronic toothbrush, they sell different toothbrush heads, so you can switch the head off every couple of months as well. So kind of that 2, 2, 2. Hopefully that will help you remember. And then mouthwash after you brush to remove any remaining particles. So we wake up, we floss, then we brush for a couple of minutes, and then we rinse with mouthwash. And so that will help kind of remove everything that we've just flossed and brushed away from our tooth. Leaning into fluoride toothpaste. So I would say this is personal preference. Some individuals are not a fan of fluoride, while some others are, but it is recommended that we use a fluoride toothpaste. There aren't many that I think don't have fluoride in them in today's world, but that helps to strengthen our enamel and prevent the cavities and sensitivity. So again, if you are struggling, struggling with some cavities or some sensitivity, you can also get a little bit higher fluoride content in your toothpaste. If you work with your dentist, they usually have some readily available. Brushing at a 45-degree angle. So oftentimes we may brush back and forth or top to bottom, but we want to make sure we're brushing at an angle that is towards the gum line. So this is important to do in gentle circular motions, so not to be too rough on your teeth. Medium and firm toothbrushes can actually be a little bit too rough on the surfaces, so a nice soft bristle brush is really helpful. And we want to angle towards the gum line on all sides of the tooth. So top, bottom, inside, outside, all around. Also, if you haven't, I feel like tongue scrapers are a little bit more popular now in today's world. You can find them pretty easily at the grocery store or like a TJ Maxx or any kind of local pharmacy. You can generally find a tongue scraper. I personally like a metal tongue scraper, but again, your preference if you've never tried one. This is really helpful to do right when you wake up. So it helps remove any bacteria, any acids, or any toxins that might have surfaced while you are asleep. So if you haven't tried it before, I highly recommend if you have one available, or if you're open, they're only a few dollars. Getting yourself a tongue scraper and doing that first thing in the morning. Your body is designed to naturally take care of itself. So it does all of that healing when we sleep. And so when you wake up, grabbing your tongue scraper and scraping for just a couple, maybe like 10 times or 30 seconds or something like that. It doesn't have to be a really long time. And so starting there. So that would be my recommendation, is starting with your tongue scraper, then flossing, brushing, mouthwash, and all of the above. So with that being said, making sure I don't have to tell anyone in the house today to schedule your regular cleanings, but regular cleanings can also help you reverse any poor dental hygiene effects. And I 100% support that. Not going for a long time, I can literally see so many effects reversed just by going to the dentist and working with them and following their directions and their guidance on really simple things such as a fluoride toothpaste. So again, to just be mindful of trying to schedule them when it fits your schedule best. It's also really helpful just to keep in mind we are kind of in the generation, it's called the sandwich generation, but we're helping children, but we're also taking care of parents, many of us. And so sometimes it's really hard for individuals to take care of their dental hygiene practices. and self-care routines. So for example, arthritis might make it really hard to floss or brush or things of that sort. So again, just helping those around you, recommending, regular cleanings for a dentist to help some individuals as well. So keeping that in mind, that it's a really great resource. With that being said, if you would like to participate in our last poll, I always love to, we've increased our awareness, and now what's our takeaway? I love to see what really stood out to you. What's a practice that you would personally like to increase, whether you have excellent health or fair health. What's something that you personally are interested in after attending today? We love behavior change, even if it is just for a short period of time, and that's why we continuously reach out. So I'm going to give just a few moments or so. Which practice would you like to increase? Is it flossing, brushing, maybe mouthwash, toothpaste, the certain angle of your toothbrush, a tongue scraper, or cleanings? For all my parents who might be here, I recently bought the kiddos a kid-friendly mouthwash. It doesn't have any alcohol in it. Ironic that they put alcohol in mouthwash actually after today's session. So, but she thinks it's the best thing in the whole world. So brushing our teeth is very easy now because you can't use it until after you brush your teeth. So in case you need a side parenting note, I would definitely recommend kid mouthwash because it helps your morning. But with that being said, I'm going to go ahead and end the poll here and share the results. So I love seeing these. Flossing, absolutely. That would be the one piece that I would pick. It is not my favorite task to do. We do it, but we struggle through it. Mouthwash again as well, and a tongue scraper. Yeah. If you haven't tried a metal, I recommend the metal because of bacteria. The whole point is to get bacteria out. Plastic is a little bit more porous than metal, so I definitely recommend a metal one. There are copper, there's lots of options. So check it out. But thank you so much for everyone who attended today and participated. It was really nice to see all of you, and I appreciate you being here with us today. I hope you have a lovely day. Thank you so much. Take care.